morning everybody. It's a pleasure to address all of you at PGI Chandigarh this morning. I believe a lot of medical professionals are here to discuss how technology can help in medical profession. I would like to share with you some of the excitements that we have gone through while doing the National Knowledge Network, NKN as it is fondly known to a large number of people. The National Knowledge Network is a multi-gigabit network with 1 gigabit connectivity as minimum speed at the point of interface to the institution, which has about 1500 institutions of higher education and research across the country connected together. We have institutions branching science, technology, medicine, engineering, and everything else. These 1500 institutions include about 160 medical institutions which are in the government domain at this point. These medical institutions, which are like PGI Chandigarh, PGI Lucknow, All India Institute of Medical Sciences, and several others of the similar caliber, are today using it to great advantage to advance medicine and medicine research. We expect that these networks will be used both in medicine research and in health referral systems. Let me just narrate to you what can be done about referral systems. Supposing you take Delhi-Chandigarh corridor, and if you have some primary centers which are looking at a patient who is perhaps bleeding and requiring immediate attention, he can be attended to locally at that point. If there is a high definition camera which can capture the patient in his real form, and there is a paramedic nearby, and if the same information can be beamed across NKN to a super specialty hospital, and if they can direct him as to what should be done to arrest the bleeding to save life, it can be a very good application. We are expecting that many such corridors will be developed across super specialty hospitals. While cardiology and related care requires very sensitive and very high response and very low latency networks, we have at the other end what are called the cancer related diseases which require more attention, but there is a span of time that's available which can help people plan the activities of coordination. So we have in the National Knowledge Network two grids which are focused. One called the brain grid, which has all institutions that work in brain research and brain related medical attention together, and the other one called the cancer grid, which has several subgrids. The brain grid goes from autism to Alzheimer. Right now the Alzheimer people are very active, and I find that many MRI images are being transferred across the NKN between 47 institutions where they study the Alzheimer and its effect and what else can be done on that. The high quality images like MRIs and the related ones which are very high in size, very big in size, which require very high bandwidth, and while interacting with another person, another researcher, it requires very quick turnaround time. That means I need very low latency, which is also part of the NKN by design. So these are part of applications that are already in NKN as part of medicine. I would request the medical professionals who are here to look at various other possibilities of cooperation where high quality images are generated online and shared online for useful purposes like research and medical care. And we have been positioning the medical and the ICT only in the management space all along. Now we have an opportunity to position it for healthcare delivery online and real time. When we designed NKN, there was a necessity for a quick understanding of what NKN can do for society. After several rounds of discussions and several deliberations, we came to a simple conclusion. What affects human beings all around in society is education and health. And we have two captions, two taglines actually for NKN. One is called Educated Nation is a Creative Nation. Another one is called Healthy Nation is a Productive Nation. In fact, the medical profession as a whole stands in both. The medical education itself requires very high quality doctors to teach across all medical colleges today. I often hear about paucity of medical professionals to teach. I often hear about paucity of cases to share. I often hear about paucity of rarest of the rare cases which are being done in some of the super specialty hospitals, which have to be shared online and in real time with people all around the country. And we seem to have very large number of these institutions in the private space as well, and we seem to have large number of these geographically spread. So you have to worry about a certain methodology by which you can leverage the presence of NKN, where you can capture these images even in an operating room online and real time with multiple cameras, fuse them as you like, as you deem fit for medical profession and medical education, and share it with the rest of the people. The second one is, if you can use the recorded information and also online information like what I am doing in this lecture with many of the people for continuous medical update, where the education takes place online, real time, or even in an orchestrated fashion when people have doubts. Also, I am told that skilled professionals who can take blood pressure, for example, blood sample, for example, are required all over the country. If you have public health centers with some modern equipment, still you need people who can handle the patients, and they have to be taught how exactly this has to be done. These are normally done by nursing courses where skills are imparted. As the equipments change, as the gadgets change and it becomes electronic, and the way you share and the way you transmit it and the way you store and the way you react, that also changes with the time. This online and real time and also progressively changing, dynamically adjusting education space in the skill space is becoming available for medical education especially. And I think you doctors have to worry about it very seriously and then see how you will have a band of professionals who can help you on an ongoing basis in this large country, because we are talking about something like 250,000 panchayats, and we are talking about 6 lakhs villages, and we are talking about public health centers spread out all over the country. Barring the economics apart, where the digital part of these equipment are being used all over, if you go to a super specialty hospital like AIIMS, you will find that all digital equipment are available. If you calculate whether the same set of equipment should be available for a public health center or something of the same sophisticated variety should be available, and if you multiply by the number of centers which are in lakhs, you will get astronomical figures like lakhs of crores of investment, which may or may not be feasible. On the contrary, I would urge the medical professionals who worked with physicists, biologists, engineers, technologists to come up with very, very inexpensive low cost alternatives which do exactly the same thing, because the technology has changed tremendously in the last 10 years, and it is possible, if we set our minds together, to do all this development and make this happen in a very short time. And I think we should take it as our mission to embark on such a journey when all the medical professionals are together to find out what are the basic things that should be present in digital form in all these places and how to make it possible. Let me tell you a small incident. When I walk into National Physical Laboratory in Delhi, I find several inventions available there. One of them measures blood pressure. Let us say the specificity, the sensitivity associated with it, the resolution, the acceptability in the medical profession is wanting. Now, if we can do something about improving what is used there, the sensor, the processor, the way the signal is acquired, the way the signal is processed over a period of time. If all these things are addressed by the physicists, the researchers, the engineering people who can do the entire processing of the signal alongside, and the medical professionals who can vouch for it, we will have what we can call it as a digital blood pressure monitor, which can even be a wearable device. Now we have to start thinking along these lines, and these wearable devices, when made in millions and millions, will become affordable even for individuals, and all they have to do is to wear those watches or whatever, which will be wirelessly picked up by the public health center for further processing. And you can take, instead of patient coming to the hospital or the primary health center, the health care can be carried to the patient no matter where he is, because mobile technology is available. We have to start thinking along those lines now, because acquiring information in the large, storing information, processing them, understanding them, projecting them, displaying them, they all have become well understood the technologies today. In fact, this very lecture that you are seeing, I am not currently in Delhi, which was the original plan. I am recording it somewhere else in one of the NKN nodes, and it is being played to you exactly at the point of requirement. It doesn't make a difference where I am physically, but I can reach you at the appointed time, because the system takes care of it. You can do the same thing, and you can do whatever is required at any given point in time. Let me tell you another advantage of these ICT technologies. Supposing there is a critical case and several parameters are measured and shared, made available. The person who is to look at it from a super specialty hospital is busy with another patient inside an operating theater. His time is not available. It is possible for this electronic network, a national knowledge network, to scan all the 160 institutions and more if they are connected in the future, and make it available to all the specialists in all the hospitals simultaneously, and any one of them or many of them can look at it simultaneously. It can go even across disciplines. You can even practice what is called a multidisciplinary approach to a particular patient's problem solving. All these are becoming a reality. How to absorb it into the medical profession, how to make it part of the medical protocol, how to make devices that you design, you devise, you produce with the help of the scientist friends and engineer friends of yours, is a matter of detail so far as I am concerned. These possibilities are now becoming available to you. So I would urge you to look at all these possibilities, because NKN is available, which does a gigabit at the ends and tens of gigabits in the middle, and a lot of security framework is part of it. Any amount of application security that is required can also be embedded. Any type of access device like tablets and smart PCs upwards, any cameras that you have can be incorporated into the system. Now it is entirely up to your imagination to think of a method to use it in education or in healthcare delivery or in any health understanding across the nation. I will stop my talk with sharing only one small experience. When I was in IIT Madras, we did one IR sensor based, camera based device for breast cancer screening. 2 days back, Vijaya Hospital in Madras has opened what is called a breast cancer clinic, which I happened to inaugurate 2 days ago. This was an effort which spanned something like 6 to 7 years. It was not a one-day affair. It took us 3 years to perfect the algorithm alone. Now it is a device that is usable by a hospital. It is going through some trials. It will go through phase 1, phase 2, phase 3 and so on before it becomes largely usable. And of course, during the time, as an engineer and technologist, I will start worrying about how to reduce the camera cost, how to reduce the sensor cost, how to reduce everything else associated with it, so that what has come down from couple of crores of rupees of investment to something like 30 lakhs in today's equipment that I have made will come down to something like 3 lakhs in about 2-3 years time, and maybe about 30 rupees so that everybody can buy on their own. Thank you very much. Thank you for this opportunity to address you remotely, and I urge all of you to look at NKN more seriously at www.nkn.in, where all the institutions that are connected are presented, and see what opportunities it can create for you and for your work and for your students and postdocs around you. Anything that you need from us, do let us know. I'll be happy to help. Thank you very much.